thing about Ron, again, is his compassion and respect for every individual that walks through the doors of St. Vincent DePaul Place. He leads by example and challenges each of us to do the same. Ron Krom.
Very humbling. For those of you who know me well, you most likely are aware that it's difficult for me to be in the spotlight for an award like I'm receiving tonight. Not because I doubt or belittle the successes that we've had in support of housing in Middlesex County and at St. Vincent de Paul, Middletown, and not because I fail to recognize the role that I've played over the past years. What makes me a bit uncomfortable is that I'm receiving an award for advocating for something that seems so simple, so intuitively right. How many times have we heard supportive housing works? It's the right thing to do, it makes sense. We know that supportive housing is cost effective, and we've all worked with those high utilizers of our homeless systems of care to know that there's a better way. So it seems like supportive housing is really not an extraordinary idea, and it seems so natural for me to be an advocate. I come to this work with a background in training in theology and public health. From a theological perspective, caring for the poor, the homeless, the hungry, and the marginalized folks in our communities is what guides and informs my work and my life. People who are homeless have names and faces and stories. They have a right to be housed with dignity. Many of the chronically homeless are also burdened with addictions and mental illness, years of poverty and rejection and failure. It's our job to house them and to listen to them, believe in them, encourage them, and empower them. For me, the core principle of the Housing First model is consumer choice. We so want to help folks to make the right choices that we stop being supportive of them and their choices. Once that happens, we run the risk of losing their trust and the opportunity to be there for them in the moment when they need us most. From a public health perspective, we're all familiar with the mantra that housing is health care. Again, it seems so obvious. How can anyone be expected to care for themselves, mentally, physically, medically, spiritually, whatever, when their thoughts are centered on their daily strategies for survival? From the safety and security and stability of one's own apartment, it becomes possible, perhaps for the first time in years, for someone to rethink their priorities and goals. The data reports improved quality of life, fewer ER visits, hospitalizations, incarcerations, less substance abuse, and so on. Again, we know from experience and have the stats to back us up that the fact that the chronically homeless do remarkably well living in apartments scattered throughout our communities. Since you've chosen to honor me this evening with a Supportive Housing Advocacy Award, I feel compelled to advocate on behalf of the chronically homeless. To those of you in the room who are providers, especially the case managers, remember that we've been entrusted by the folks we work with to be supportive, to rejoice in their joys, and to lift them up when they fall, even if it's over and over again. When I hear someone's story, I like to think I'm receiving a gift, the gift of their life, and I am to treasure that and care for it and embrace it. When we truly give up our own need to mold and shape someone else's life, they'll know it. Such an unconditional and non-judgmental approach to services lends itself to the criticism of enabling. And when I first heard Sam Severus of Pathways to Housing in New York City speak many years ago, he said, "Of course we're enablers. We enable people to remain successfully housed." To those of you who enable people to stay housed, keep doing whatever it takes. That's really what this is all about. And to those of you in the room who are funders and government leaders, first of all, I'd like to thank you for your help in helping to make this work possible. You've taken the time to review the data, you've learned the benefits of supportive housing, and you continue to fund more programs and more opportunities for us to house the homeless. As you design new programs, keep the vouchers and support service dollars coming. The vouchers are literally the key to an apartment, and we need everyone we can get. My bias is clearly in favor of scattered site funding. In most of our communities, there are plenty of apartments. We can get folks housed quickly and relatively cheaply, and the need is so great, and the need is now. Finally, remember that the challenges for housing the chronically homeless demand that we be flexible and person-centered, that we have policies that fit our target populations. Help us to make this as easy as possible. In closing, I'd like to thank the Middlesex County Coalition on Housing and Homelessness for some great leadership and activities in our area of the state. I appreciate working with you and thank you for the trust and confidence that you've placed in me. I'd also like to thank the board and the staff of St. Vincent DePaul Middletown. Without the support of the board and the dedication and commitment of the staff, we would not be the model provider of supportive housing that we are today. And finally, I'd like to thank each of you here tonight for all the work that you do to bring an end to homelessness. Thank you.